Let's take a deep dive into hyperbaric medicine in the United States. We've got some really, really interesting material here that kind of lays out the history, the key players, certification, and, well, the tricky bits like reimbursement.
Exactly. And it's fascinating how it really evolved. What started mostly for divers, dealing with the bends.
Compression sickness?
Yeah, that. It's broadened out so much now, covering a whole range of clinical things you might not expect.
So just to make sure everyone's on the same page,
Yep.
what is hyperbaric medicine today? Like, in a nutshell.
Basically, think of it like this. Patients breathe pure, 100% oxygen inside a chamber where the air pressure is increased, significantly higher than normal.
Okay.
And that high pressure allows the lungs to gather much more oxygen than usual, getting it into the blood and tissues. This helps with things like healing stubborn wounds, fighting certain infections, treating carbon monoxide poisoning,
Okay.
and even exploring potential uses for, neurological issues.
Got it. So our mission then for this deep dive is to really map out the landscape of hyperbaric medicine in the U.S. Trace its roots, see who the main organizations are, figure out where it stands now.
Sounds good. Yeah. Understand the whole ecosystem.
Ready to jump in?
Absolutely. Where should we start? History.
Yeah, let's start there. Back in the day, it seems the Undersea Medical Society, UMS, was the main group.
That's right. And the name tells you their focus was squarely on diving issues. Makes sense for the time.
But things changed.
They did. The UMS saw that hyperbaric oxygen had potential way beyond diving. So to reflect that, they actually changed their name
To what?
to the Undersea and Hyperbaric Medical Society, UHMS. That little addition and hyperbaric, that was a big signal.
Yeah, that really marks a shift, doesn't it? So how influential is the UHMS today? Or, well, based on our source from 2016.
Well, back then they had over 2,300 members. And it wasn't just US-based. They had chapters internationally, Canada, Brazil, plans for Saudi Arabia. So pretty significant reach.
Okay, a big network.
Right.
But not the only game in town, right? I think I saw mention of a group just for the doctors.
Yes, exactly. The American College of Hyperbaric Medicine, ACHM, that was founded in 1983
Oh, okay.
by some key figures, Doctors Neubauer, Schilling, Maxfield, and J.R. Maxfield. It was really the first U.S. physician group dedicated only to hyperbaric medicine.
When you think about pioneers who really pushed this field forward early on, any names stand out?
Oh, definitely. Dr. Edger End is one. He did some really early important work using hyperbaric oxygen for CO poisoning. But here's the kicker.
Yeah.
He also invented SCUB.
Wait, really? The same guy? SCUBA and hyperbaric treatments.
The very same guy. It's an amazing link, isn't it, between the diving world and the clinical world?
That's incredible. So he wasn't just focused on diving accident.
Not at all. He saw the potential for neurological stuff, too. He actually published a paper with Dr. Neubauer, who you mentioned, back in 1980, on using it for stroke.
And Neubauer himself is a big deal in this area.
Absolutely. He really championed using HBO for neurological conditions, stroke, MS, brain injuries from lack of oxygen. And he was ahead of his time using SPECT scans to actually visualize the effects on the brain.
Okay, so we've got the key organizations, the early visionaries. What about the actual facilities, the places patients go? How did that landscape change over time?
Right, let's look at the numbers. By 2014, there were roughly 1,200 hyperbaric facilities in the U.S., but the type of facility was shifting.
How so?
We saw more growth in what are called monoplace chambers designed for just one patient at a time.
Okay.
But at the same time, there was a decrease in the number of facilities open, 247 for emergencies.
Fewer around-the-clock places. Why was that happening?
It's a mix of things. Contract management companies came into the picture, running costs went up, staffing's expensive, and the financial burden of treating uninsured emergency patients. That made it tough for some places to stay open 24/7.
So economics playing a big role in access, especially for urgent care.
Definitely. And here's another interesting, maybe slightly concerning trend the article points out.
What's that?
A big jump in freestanding hyperbaric centers. Maybe in spas, chiropractors' offices, even people setting them up at home. Often using these low-pressure chambers, sometimes called GAMO bags.
And using them for?
Often for uses that aren't really approved or backed by strong evidence, what we call off-label uses.
Right, so you get easier access, maybe, but questions about whether it works and if it's being done safely compared to a proper medical facility.
Exactly. It raises that whole issue of quality control, which leads us to
Efforts to ensure quality.
precisely. The UHMS saw this need and stepped in. In 2001, they set up a clinical hyperbaric facility accreditation program.
What was the goal of that program? What does it look for?
The main things are ensuring proper staff training, making sure the equipment is safe and maintained, and checking that they follow best practices for patient care and keeping good records.
Okay. Is that accreditation mandatory now? Does every facility have to get it?
No, not nationally. When this article was written, it was mostly voluntary. Utah was an exception. Their Medicaid program required it for payment.
So a bit of a patchwork system.
Yeah. But it seems the idea was catching on internationally, too. Countries like Brazil, Mexico, Australia, others were looking at the UHMS model to set up their own accreditation.
Interesting. So a push towards global standards, maybe?
Seems like it.
Let's circle back to the ACHM, the American College of Hyperbaric Medicine. What's their main function?
They're basically the professional home for doctors specializing in hyperbaric medicine in the U.S. and some international members, too. They represent those physicians.
And what do they do?
A lot, actually. They advocate for the specialty, they push for recognition, they support certification efforts, put on conferences, publish guidelines, that kind of thing.
So really trying to establish hyperbaric medicine as a proper specialty.
That's a big part of it. They even teamed up with the American Professional Wound Care Association, APWCA, for certifications. Physicians can get certified in hyperbaric medicine, wound care, or both through them.
Okay. But it's important to mention these specific certifications aren't recognized by the main board, the American Board of Medical Specialties, the ABMS.
And that lack of ABMS recognition, that probably affects how the specialty is viewed by the wider medical world.
It can, yeah.
Yeah.
It impacts things like hospital credentialing, sometimes reimbursement. It's a hurdle they're working on.
So this new wound care exam they were developing with APWCA, what's the strategy there?
By creating a really solid physician-centric wound care certification, they're aiming to, boost the professionalism and maybe down the line get that broader specialty recognition. The long game.
Makes sense. Okay, let's talk money. Reimbursement, always a critical piece. What challenges has this field faced?
Oh yeah, reimbursement is a huge ongoing issue. The ACHM has been right in the thick of it, working with UHMS and others, fighting funding cuts, trying to get Medicare fees increased, especially for hospital-based units where most treatment happens.
So actively lobbying CMS, Medicare? Absolutely. For instance, back in 2003, they were pushing CMS hard about the payment level, the RVU, relative value unit for the code doctors use when they supervise HBO treatments, CPT 99183.
Why was that code so important?
Because supervising these treatments requires the physician to be constantly present, there's significant overhead. If the payment doesn't reflect that, well, fewer places will offer the service. They argued the RVU was way too low.
Gotcha. The payment has to match the work and cost involved.
Exactly. And there's another big scare around that time, HCFA, which was the agency before CMS.
Right.
They proposed stopping payment for using HBO to get wounds ready for skin grafts, a really common and important use.
Wow, that would have been a massive blow to wound care.
Huge. The UHMS, with ACHM backing, proposed a new indication, ischemic wound, to try and preserve coverage for those patients.
Did that work? Did they accept ischemic wound?
CMS didn't adopt that specific term, but they did release a final policy in 2003 just for diabetic wounds of the lower extremities, DWLEs.
Okay, so specific rules for diabetic foot ulcers. What did Medicare say? When would they cover HBO for those?
There were clear criteria. Patient has to have type 1 or 2 diabetes. The wound has to be, because of the diabetes, it needs to be pretty severe, Wagner grade the second or higher. And crucially, they must have already tried standard wound care and it didn't work.
So not a first-line treatment.
Definitely not. It's an adjunctive therapy used when other things have failed. That's key.
And how did the payment work? Any differences there?
Yeah, there was a difference. Hospital outpatient departments could bill a facility fee and the doctor's professional fee. Freestanding centers could only bill the professional fee. They made the professional fee slightly higher for freestanding centers to try and compensate, but it still creates different financial incentives,
Yeah, I could see how that would affect things. Any more recent funding battles?
Oh, yes. A big one in 2015. Blue Cross Blue Shield, in some starts, suddenly decided to label treatments for things like radiation injury, which have been standard for years, as investigational.
Investigational.
Yeah.
Meaning not covered.
Exactly, not reimbursed. And radiation injury treatment, that's a huge part of what hyperbaric centers do. The article estimated like 40 to 60% of all treatments in the U.S.
That must have sent shockwaves through the field. 40 to 60% suddenly potentially not covered.
It was a major crisis. Some programs actually closed. It definitely put a chill on anyone thinking about starting a new program. Just huge uncertainty.
So how did the hyperbaric community like the ACHM respond to that?
They fought back with data. They launched the radionecrosis registry.
Radionecrosis, that's the radiation injury.
Right. The idea was to collect solid evidence, real-world data, on how well HBO works for these injuries, and if it saves money in the long run, build a case for coverage.
How'd that go? Did they get much data?
At the time the article was written, yeah. 3 states were hit hardest by the BCBS change, and the registry already had over 1,000 cases. That made it the biggest study ever on that specific use.
Wow. Using data to prove value. I also saw something about Medicare tying quality measures to payments.
That's right. Medicare started publishing specific quality measures for both hyperbaric medicine and wound care, and doctors' reimbursement could actually be affected by how well they performed on those measures. It's part of that bigger shift towards pay for performance in healthcare.
Okay. We've spent a lot of time with the physicians and the organizations. What about the other team members? Technicians, nurses. They're vital too, right?
Absolutely critical. And there are organizations for them, too. For technicians, there's the National Board of Diving and Hyperbaric Medical Technology, NBDHMT.
NBDHMT. That started back in '85.
Yep. Initially, it was focused, again, on diver medic technicians, DMTs, formalizing their training, getting them certified. A lot of that training actually started out on remote oil rigs, needing advanced medical skills far from hospitals.
Interesting origins. Did it stay focused just on divers?
No, it broadened out. By 1991, they changed the name to NBDHMT because more hospital-based techs and hyperbaric nurses were getting involved.
Yeah.
And that year, they introduced certifications specifically for hyperbaric technology. Then came hyperbaric nursing certification in '95. And get this, veterinary hyperbaric technology certification in 2011.
Hyperbarics for animals. Seriously.
Apparently so. It just shows how the applications keep expanding.
That's wild. Okay, so nurses, the Bare Medical Nurses Association, BNA. That sounds like their main group.
It is, and hyperbaric nursing actually started in Europe way back in the 50s, mainly supporting the big multi-place chambers as treatments expanded beyond diving.
And the training evolved over time, from just learning on the job.
Yeah. As monoplace chambers became more common in the 60s, the need for more formal training grew.
What kind of nurses typically went into this field early on?
A lot came from high acuity areas, critical care, ER, med-surg. They brought really strong assessment and patient management skills, and often got involved in research, too.
And the BNA formed in '85 to give them a professional identity.
Exactly. And it's international now. They have a clear definition of barometrical nursing, dealing with patient responses to that unique hyperbaric environment.
What's the role of a hyperbaric nurse like? Sounds complex.
It really is multifaceted. They're clinicians, educators for patients and families, sometimes researchers, often managers involved in running the unit. The goal is always safe, cost-effective, quality care.
And certification is important for them.
Very. The BNA worked with the NBDHMT initially to get nursing content into the certification exam. Then, in 1995, they formed their own board, the Barometrical Nurses Association Certification Board, BNACB.
BNAECB.
And now there are over 900 certified hyperbaric nurses with different levels like CHRN, ACHRN, CHRNC, showing different levels of expertise.
Got it. Okay, so we have the people, the organizations, the history. Let's nail down the why. What conditions is hyperbaric oxygen actually approved for?
Right. So despite some of the challenges, this is a field with a lot of science behind it. The article mentions over 6,000 studies. The UHMS, through its committee, officially supports HBO for 14 specific conditions based on their review of the evidence.
14. Can you give us the highlights? What kind of things are on that list?
Sure. Definitely carbon monoxide poisoning, also cyanide poisoning, air or gas embolism, bubbles in the blood, gas gangrene, which is a nasty infection, crush injuries, compartment syndrome, decompression sickness, of course, certain problem wounds like diabetic foot ulcers we discussed, or wounds from poor circulation arterial insufficiencies, severe anemia where transfusion isn't possible. There are others like radiation injuries we talked about, certain bone infections. It's quite a list.
It is diverse. Are there any conditions where the UHMS says, yes, the evidence supports this, but maybe insurance, like Medicare, says, not so fast?
Yes, that happens. The source mentions a few. Things like intracranial abscesses, acute thermal burns, and sudden hearing loss. The UHMS sees supporting evidence, but coverage isn't always guaranteed.
So that gap between scientific support and payer coverage is still there.
It is. It highlights that constant need to demonstrate not just that it works, but that it's worth the cost to payers.
And is research ongoing for new uses beyond those
Oh,
14?
oh, definitely. The UHMS actively encourages research into what they call investigational uses. The field isn't static. They're always looking at where else HBO might help as new evidence comes in.
Okay. If a doctor wants to specialize in this, where do they go? Are there formal training programs?
Yes, there are dedicated fellowship programs in undersea and hyperbaric medicine. Several universities and medical centers offer them.
Like where? Can you name a few?
Sure. The list includes places like Duke, Hennepin County Medical Center in Minneapolis, LSU, SUNY upstate in New York, UPenn, UCSD. The Air Force has a program. Quite a few options.
And these fellowships cover the whole spectrum. Diving, wound care, clinical hyperbarics.
Generally, yes. They provide that specialized post-residency training needed to become an expert in the field. Many are ACGME accredited, which is the standard oversight body for residency and fellowship programs.
So established pathways exist. Let's try and pull this all together. Looking at the current state of hyperbaric medicine in the U.S., what are the biggest hurdles it's facing right now?
Well, there are some pretty significant, almost existential threats, according to the source. Shifting Medicare policies are a big one. Then there's the perception, at least among some payers, that there isn't enough top-tier evidence for everything. Add in increasing regulations and the constant pressure on reimbursement, it's a tough environment.
It sounds like they're constantly having to justify their existence and value.
In many ways, yes. And the structure matters too. Most treatments happen in hospital outpatient clinics. These operate under specific provider-based rules which allow them to bill those facility fees we mentioned, but only if they meet strict supervision requirements.
And CMS and the regional Medicare contractors have their own rules for who can supervise and bill for it.
Exactly. Specific criteria for physicians billing that CPT code 99183 for supervision.
So layers of rules and guidelines.
For sure. The UHMS even has its own credentialing guidelines for doctor supervising treatments, adding another layer focused on ensuring competence and safety.
Okay. So wrapping up our deep dive, what are the main things you think our listeners should take away about hyperbaric medicine in the U.S. today?
I think first, its evolution is key from just diving to a much broader clinical tool. Second, the importance of organizations like UHMS and ACHM in shaping the field, setting standards, advocating. Third, certification isn't just for doctors. It's crucial for nurses and techs, too, for quality care. Fourth, the reimbursement struggle is real and ongoing, constantly shaping access and practice. And finally, there are dedicated training paths for those who want to enter the specialty.
It really strikes me how dynamic this field is. You have this treatment with clear benefits for certain serious conditions backed by science, yet it constantly faces these hurdles related to cost, evidence perception, and regulation. The dedication of the people working in it seems vital.
Absolutely. They're clearly passionate about the potential of HBO and are working hard to navigate those challenges and solidify its place.
It really makes you think, doesn't it? So here's something maybe for you, the listener, to ponder. When you look at hyperbaric medicine, with its proven uses, its investigational areas, the constant pushback on coverage despite evidence in some cases. What is this whole situation to challenges, the fight for recognition, the dedication involved? Tell us about how new or specialized medical treatments find their footing, or struggle to find their footing, within our bigger, often fragmented healthcare system. It's definitely food for thought.